Hi, this is Sean Carney, the president of 40 Days for Life. Welcome back to the vlog. And today we have a very important topic and a special guest, former abortion provider, Dr. Haywood Robinson, who retired from medicine and now serves on our 40 Days for Life team. He will be discussing the shameful response of Planned Parenthood and the abortion industry to the COVID-19 crisis, how they are trying to profit from this pandemic, and he's even going to discuss one abortion provider appreciation day that took place in the midst of the coronavirus pandemic. So Haywood will come up in a moment. Before we introduce Dr. Robinson, I want to thank all of you who joined us on the Perseverance webcast. We've had a lot of views. If you didn't get to watch that, we report all the wonderful statistics, including the 10 abortion providers who had a change of heart during the spring campaign. That's near a record for us during one campaign to have 10 abortion workers have a change of heart, but we share all the results. It's kind of a world tour. That is the Perseverance webcast that is on the YouTube channel. So please check that out. And on that, we announced a $98,000 matching challenge. In the midst of these difficult financial times, we had a few donors come together, donors who participate in 40 Days for Life, who wanted to maximize their gift by challenging people to give a matching gift up to $98,000. It goes through Tuesday. So if you are able, please contribute to that. We've had a lot of donors come forward, so thank you if you have given. And to give more value and more pro-life resources, we are offering for a $40 donation a signed copy of the book, To the Heart of the Matter. And if you give $60, you get a signed copy of To the Heart of the Matter, The Beginning of the End of Abortion, and an unplanned DVD to give you more pro-life resources. And if you become a monthly donor at $20 a month or more, we will send you all of that and a tote bag. And so we're trying to run some of these special offers to help hit our matching challenge by Tuesday. As if you watch this blog, you know that the abortion industry has had a ridiculous but not surprising response to the COVID-19 crisis, and to handle that matter very directly, and someone who has experience is Dr. Haywood Robinson. Haywood?
Boy, being sheltered and in place, it's given me an opportunity to reflect more, to read a bit, pray a bit, to be without our friends on the campaign and the vigils. Boy, I've missed them. My last stop before we had to discontinue our campaign and vigil visits, I was in Oregon. What a wonderful place. Portland, Salem, Eugene, you folks were just awesome. So I can't wait to get back on the road in the fall. But until then, we've got plenty of work to do. And you know what's going on out there is just simply amazing. The other side, the pro-death side, is just really, truly showing us their colors. You may be aware that several states decided that they would ban all non-elective or ban the elective procedures for surgery, medicine, etc. But just listen to this statement put out by Planned Parenthood just a few weeks ago, and I'll go ahead and share it with you. Abortion is an essential and time-sensitive medical procedure, and it must remain so during this public health crisis. Delays or additional barriers to care can make it more difficult or even impossible for patients to access safe, legal abortion. Well, the lie continues. Abortion is not safe. Yes, it is legal, but it's against God's law. In New York City, Governor Cuomo has declared that abortion is indeed an essential medical procedure that needs to continue. So they need to continue to expose their workers, expose patients to this virus, and also create situations where people who will have complications from their abortions Now we'll take away resources from people who actually need them. There was an article that was released in Vogue magazine approximately a week or so ago. And this is about a doctor who I'll not mention her name. However, this was out of the Vogue magazine in their health and I believe fitness section. And it's about this lady giving us the story that's going to have us to foster pity for the poor, downtrodden, exploited abortion industry. Now, before we get in that article, we need to remind ourselves that their modus operandi, the business model of the abortion industry, is simply this. You give them cash, and they give you a dead baby and a damaged mother. It's all about the money. Without the variable of money in this abortion industry equation, there would not be this abortion distortion holocaust that we're living through right now. This particular female OBGYN says during this pandemic, she remains 6 feet from her husband. They no longer kiss, touch, use the same bathroom, or sleep together. She says she's doing everything she can do to keep her husband safe. Isn't that touching? Wow. How noble, how sacrificial this baby killer is. She won't risk her husband getting an upper respiratory infection, but killing a baby? Not a problem. I don't know if I really believe this in the first place. There's a saying that a liar is a murderer, and I think the converse is true. I think this lady is basically making this up the way liberal media, and particularly the abortion industry and their lobby, they just make it up. She went on to say how the abortion industry itself is suffering an inhumane challenge. Now, baby killers, inhumane challenge. Get it? Boy, they are just going way off the edge. She goes on, as I said, to say there's an onslaught of attacks from GOP politicians who are attempting to use this pandemic to ban abortions. I may have mentioned earlier how many states have said, no, this is going to be a time because of stress resources. We're not going to have any type of elective medical procedures. Abortion just happens to be one of those procedures. And as we know, abortion is not medicine because pregnancy is not a disease. The worst possible complication that could come from allowing a pregnancy to continue is a live baby. And how bad is that? You know, there was also something that happened approximately a month ago in St. Paul, Minnesota. Their city council passed a resolution unanimously, 7-0, recognizing Abortion Provider Appreciation Day. So we've now gone on to where we see leadership in municipalities that are awarding and recognizing the goodness of these baby killers. It's absolutely horrible. I think many of you remember how when they passed that horrible bill in New York City, how Governor Cuomo lit up the Empire State Building pink to celebrate their wonderful baby killing bill. There's something else that Governor Cuomo did, and that was to withhold the use of hydroxychloroquine from the use of the private practice physician. So that would be family physicians like I used to be before I retired, general internists, pediatricians, who could see patients early on in this disease process and possibly prevent many of these people from having to go to the hospital. You see, it's funny how these pro-choice people who said these decisions should be made between the doctor and the patient. But they really don't mean that. They really want to control. It's about authoritarian behavior from the left. they are now causing this epidemic to be worse in New York by not allowing the primary care physicians to give the very drug that seems to have hope with these COVID-19 patients. So it's the boots on the ground, the primary care doctors, who are the ones who are not even allowed right now to be a part of this fight. So here we go. We continue to fight. We continue to see how the media and outlets such as Vogue, how far left-wing extremist politicians continue to expose themselves and give us, along with the Lord, a very clear target. And I'm just so thankful I could be here, and I'm just looking forward to hitting the road again in the fall. And thanks for having me on, Sean.
Thank you, Haywood. And one of the themes you hear from Dr. Robinson and so many former abortion workers as they're in the industry is justification for your work. Nobody grows up wanting to be an abortion doctor. Nobody grows up wanting to work in an abortion facility. And you see that justification at a new level during the coronavirus pandemic as they try to deem themselves essential and do ridiculous and inappropriate things like hold an abortion doctor appreciation day, which is insane and certainly insensitive to those who have had an abortion, who don't really want to discuss it and don't run flowers and gifts up to their abortion doctor's offices like you would do for another doctor. And so it shows their disconnect, and a lot of that comes from the constant justification that is required to justify that which cannot be justified, which is murdering a baby. And so you see a lot of that. If you want to go back, we discuss a lot of this in the Perseverance webcast. And again, thank you for those who have given to our matching challenge. And if you give $40, you get the book. If you give $60, you get 2 books and the DVD. And if you become a monthly donor, you get all that and a tote bag. So thank you for those of you who have given what you can in these tough times. And we look forward to the coming weeks. We'll have a lot of announcements about some things happening. And if you have not heard yet, myself and Abby Johnson will be on live for the Unplanned Watch Party on Wednesday at 9 p.m. Eastern. So be sure to check that out at 40daysforlife.com/unplanned. We will see you next time.